Hi, good afternoon, everyone. This is Lori Smetanka. I'm the Executive Director of the National Consumer Voice to Quality Long-Term Care, and welcome. We're glad to have you with us this afternoon, joining us for today's webinar. We are going to be getting started in just a minute as we're letting folks come in to the program. While folks are coming in, we will cover some housekeeping issues today. So first, as you just heard, the webinar is being recorded. All lines will be muted throughout the course of the webinar, but you should be hearing the different speakers that'll be talking today. We're asking that you use the Q&A feature on your control panel to post any questions that you have about any of the things that are being talked about. We'll get to as many questions as we can at the end of the presentations. There's also a chat function on your control panel, and you can use that to make comments or respond to any questions from the speakers or other attendees, to chat amongst yourselves. I did mention that the program is going to be recorded, but the slides and the recording will be available on the Consumer Voice website either tomorrow or Monday at the latest. As soon as we can get it up, we will do that, but that will be available, and we'll email them out to all of you who are participating today as well. So we're delighted that you're able to join us today, and again, welcome. So those of us that are going to be talking today include me and the rest of our policy and program team. So many of you are very familiar with our staff, and we're delighted to have Robin Grant, who's our Director of Public Policy and Advocacy, Sam Brooks, who's a Manager of Program and Policy, and Jocelyn Bogdan, who's our program and policy specialist, who are going to be going over the content of today's program. And we're going to be sharing speaking responsibilities so that you get to hear from all of us. We wanted to do this program today because there's a lot happening legislatively right now and on Capitol Hill. Legislative advocacy is a core component of the work that we do at the Consumer Voice. We know that it's the same for many of you. You actively work to support legislation, encourage your Congress members to introduce and pass legislation that will improve quality care, quality of life for residents, to protect residents. And so, every year there are a lot of bills that are introduced that we follow, and we try to share as much information with you all as we can about the different pieces that are being introduced, and when it's time to take action on those, we do try to follow those pieces as well. But now is a particularly busy time in Congress because they are in the process of working on their budget reconciliation bill, from which they often pick other pieces and provisions from other types of legislation, incorporate it into a budget bill to pass. And it's one of the biggest times of the year when we do try to look at, are there opportunities to include provisions that will make a difference for residents or for the constituents that we're working with. That's not to say that other pieces of legislation aren't important, and we're going to be talking about new legislation that's been recently introduced that we've sent you e-blasts about, but wanted to cover for you as well today, so you had an idea of what some of the things are that Congress is considering, talk about how the process is going to be moving forward, particularly over the next couple of weeks. And then as we move into the end of the year, share with you a range of different legislation that we're following, and then talk about just a couple action steps that you can take to help influence your members of Congress and encourage them to really make a difference in the lives of residents. So we are going to start today by talking about a new bill that was recently introduced, the Nursing Home Improvement and Accountability Act. And for that, I'm going to turn to Robin Grant, who's going to lead us through that part of the discussion. So Robin.
Thank you, Lori. So over the past few months, key members of both the House and the Senate have indicated their really strong commitment to getting significant nursing home reforms passed. To that end, both chambers have introduced the Nursing Home Improvement and Accountability Act, which would increase transparency, accountability, and oversight in nursing homes, improve staffing, and support innovation in both the structure and culture of facilities. Next slide, please. So on the House side, the bill is H.R. 5169, introduced by Chairman Neal of the House Ways and Means Committee. On the Senate side, it's S. 2694, introduced by Chairman Wyden of the Senate Finance Committee. This legislation would be a very big step toward quality of care, better quality of care, and better quality of life for residents throughout the country. So what we want to do today is to give you a high-level overview of the bill, which has a lot in it. Because we don't have time to go into detail, I just want to urge you to contact us. Please contact us if you want more information or you would need or want a more in-depth explanation about the issues. Next slide, please. As you can see from the slide, the bill is divided into 3 sections or titles. So we're going to just jump in right away with Title 1, Transparency and Accountability. Next slide, please. So here's what the bill calls for in this first title. First, it will penalize facilities for submitting inaccurate data, including resident assessment data. This would improve the accuracy and the reliability of the data and give consumers better information to use in making informed choices about where to turn for care, because it would impact the 5-star rating system on Care Compare. Second, the bill would require CMS to audit a representative sample of Medicare cost reports. So cost reports show a facility's revenues and expenditures, but the problem is they aren't audited, so we can't trust the information. Conducting audits would help determine whether the federal funds, the Medicare, Medicaid funds that a facility receives are being used appropriately for the care of residents. The third thing the bill would do would mandate the Secretary of Health and Human Services to review the effectiveness of the survey and enforcement process. I think this is extremely important because advocates and consumers alike have been concerned for years that this process is not functioning appropriately or well. So the review would look at a wide range of issues that are outlined in the legislation, including scope and severity, and then funding would be provided to state agencies to improve oversight processes. Fourth, the legislation would ban arbitration agreements between any Medicare and or Medicaid certified facility and a resident or the resident's representative. It would actually go even farther, though, and extend beyond nursing homes to cover providers of any home and community-based Medicaid waiver service, which means it would apply to assisted living facilities that have Medicaid beds. Then the last provision in this first title requires CMS to expand the Special Focus Facility Program to at least 5% of all certified facilities. Right now, the number of facilities is around 88 nationwide, very, very few facilities. So increasing it to at least 5% would increase the number to almost 800 nursing homes. And in addition to the extra monitoring and inspections and oversight these facilities would get, the bill would require these special focus facilities to receive on-site consultation and educational programming, with the idea of helping them to improve and to be able to get out of the special focus facility program. Next slide, please. This is Title II, and Title II is all about staffing improvements. So from our perspective, this is the most exciting part of the bill because over time, the provisions would make a really major difference in the lives of residents. So let's look at what's in this title. First and foremost, a minimum staffing standard down the road. So what do I mean by down the road? Well, within 3 years of the bill becoming law, there must be a study on the appropriateness of minimum staffing ratios. And along with that, a report with recommendations based on that study. And these recommendations would be about what those minimum ratios should be for registered nurses, and if practicable, for licensed practical nurses, LPNs, and certified nursing assistants, CNAs. So first we have the study and report, and then within 2 years of that report being submitted, rules have to be promulgated to implement minimum staffing ratios for registered nurses, and again, if practicable, for LPNs and CNAs too. So we don't have any definition to what would be considered practicable in this situation. Next slide, please. So that was kind of phase one. After that, those rules are promulgated, at the most 5 years after that first study and report, and then at least every 5 years from that point on, there has to be a study and again, a report with recommendations about minimum staffing ratios, but this time for all nursing staff, not just RNs. And then that would be followed by updating the rules for all nursing staff. So I do sometimes think you have to be a rocket scientist to understand this. It is confusing, but it lays out a path to a minimum staffing standard. And we're pleased to see that path is in there. That's what Consumer Voice, with all of you, has been advocating for, a minimum staffing standard. We've all been advocating for this for decades. The fact that the study, the report with recommendations, and the updating of regulations would be ongoing is a good thing, because it would better ensure that as time goes by, the regulations reflect the changing needs of residents rather than having them be frozen in time. But at the same time, while this is a definite path to minimum staffing standards, we are extremely disappointed that it's such a very, very long path. You should know that this is not what we've advocated for. We pushed very hard for the 4.1 minimum staffing standard to be implemented now, and then studies could be done later. So clearly we were not successful. The important thing to note here is this is not over. I want everyone to remember that Consumer Voice is 100% committed to continuing to advocate for 4.1 hours per resident day. Absolutely committed. But right now, our best chance of getting anywhere close to a minimum staffing standard is by supporting this legislation. There is a unique moment in time right now. COVID's created momentum for change. The political composition of the Congress is the most favorable to our issues it has been in a very long time. We don't support these provisions as a means of getting to a staffing standard. We may not get this close for years to come, or frankly, forever, and residents will be the losers yet again. Okay, off my soapbox, back to the legislation. In addition to the minimum staffing standard down the road, the bill would mandate facilities to have a registered nurse on site 24 hours a day, 7 days a week. And currently, RNs are only required 8 hours a day, 7 days a week. So this would go a long way to improving the quality of care. And this provision would go into effect October 1st, 2023. The legislation would also mandate that a facility have an infection preventionist at least 40 hours a week, as opposed to just part-time as currently required. Next slide, please. So the Nursing Home Improvement and Accountability Act has other important staffing provisions as well. It would provide enhanced funding through Medicaid to support staffing, for example, by including increased wages and benefits, improving recruitment and retention, reducing turnover. These are all incredibly important things. It would also support improvements in resident care and resident life. So for instance, it would expand the use of person-centered care models, and it would also, the funds could be used to provide financial incentives for private rooms for residents on Medicaid. And then lastly, the bill would improve staffing data in several important ways. First, it would allow CMS to penalize nursing homes that submit inaccurate staffing information. Second, it would change staffing hours on Care Compare so they only reflect hours devoted to direct resident care and not include administrative duties as they currently do on the website. And third, it would add weekend staffing information to Care Compare for the very first time. And we know that weekends can be a real source of a real problem in terms of staffing. So this would be very helpful to consumers. So I think all these changes related to data would help ensure that we have more reliable staffing data that is so important for consumers. Next slide. So the last section of this bill would establish a demonstration project to fund changes in the physical infrastructure of nursing homes, to put into place higher workforce standards, and to promote the integration of individual resident preferences and resident input into the daily lives of residents. So just very briefly, this includes things like modifying nursing home building requirements. So for example, limiting the size to 5 to 14 residents, creating private bedrooms and bathrooms, and shared living spaces. It would involve creating a clinical team that would consist of a licensed nurse working in partnership with CNAs in a team-based collaborative approach. And then finally, it would implement practices like facilitating a standing resident council that is run by residents. It would get resident input and incorporate that into facility policies. And there would be a real emphasis on assessing resident preferences and honoring those preferences. So in closing, I just want to underscore that this bill is really the most significant nursing home reform legislation in decades. And it really represents, I think, an unprecedented investment in the foundation of nursing home care. We will be advocating actively for its passage, but not at this very moment, because right now, as Lori mentioned, the focus in Congress is all reconciliation all the time. And I'm going to turn things over to Sam to talk about that.
Thanks, Robin, and hi, everybody. We're going to be talking about the budget reconciliation process and how it affects some of the provisions in this bill that Robin just so wonderfully described. Next slide, please. So just in a crash course in reconciliation, this is a term that's been really bandied about for months now, and both houses of Congress are knee deep in it right now. So I just wanted to give you an idea of what it is, and what the process looks like. Reconciliation is a budgetary process allowing the Senate to pass a bill with a simple majority. It cannot be filibustered. As many of you know, or all of you know, we have very gridlocked Senate. And most things need 60 votes to move, and that's something that's very hard to achieve right now. The reconciliation process, which is specific only to budgetary process, only requires a simple majority, so 51 votes in the Senate, which is achievable with the Democrats currently. So Democrats on both the House and the Senate side are currently working on reconciliation. The focus right now, you can't filibuster a bill in the House, and the House has more significant margins than the Senate. So it really counts the most in the Senate. So what reconciliation may only affect spending, revenues, or debt limits. The provisions that are in the reconciliation bill must have a budgetary effect. And cannot be extraneous. And we'll talk about that right now. A Byrd rule named after Senator Byrd from West Virginia excludes extraneous provisions. And some of those reasons for excluding these provisions does not have a budgetary effect. A provision just doesn't increase or decrease the budget, or increases spending or cost saving just too little. You cannot change the Social Security benefit program through reconciliation, and it is not within the designated committee's jurisdiction. And I'll talk about the process next. Next slide, please. So how does it work? It starts with really at the beginning of the year almost, with the House and the Senate agreeing on a budget resolution. Generally, budget resolutions should be created each year, and they create a budget plan that sets out parameters for spending for a budget over the following year. And in order for reconciliation to occur, both the House and the Senate have to agree on a resolution, and it has to have specific reconciliation directives. And what that means is these directives should task committees in both the Senate and the House to create legislation that has budgetary effects. And they also can be spending limits within those provisions. So it says, House Ways and Means Committee, you have this much money, go out and create some legislation. And so, but importantly, as I said before, the provisions must increase or decrease spending and revenues by a certain amount over a period of time, or it has to raise the debt limit. And that we all know that that's a big issue right now. And there's gridlock in Congress around the raising of the debt limit. And House Speaker Pelosi has come out in the past couple of days and said she will not use the reconciliation process to raise the debt limit. So both houses are scurrying. Then what happens is committees create legislative provisions, markup. Each committee who creates provisions around the various legislative areas that are within their jurisdiction. So House Ways and Means Committee can create provisions around Medicare and long-term care in nursing homes. The Energy and Commerce Committee creates Medicaid provisions. It's a markup process that can last days, and amendments can be introduced. But once the markup process is done, this is reported in the respective House and Senate, they're reported to the budgetary committees that then create a bill. For a reconciliation bill to pass, they must be identical. And that's true from any bills. Both the bills in the House and the Senate must be identical in order for them to pass and then be signed by the president. So all this is really an end around the filibuster and allowing just a simple majority to create budgetary related legislation. Next slide, please. So Fortunately, during this reconciliation process, the House Ways and Means Committee included 4 provisions in its markup that was drawn directly from the Nursing Home Improvement and Accountability Act of 2021, which Robin just went over. The Ways and Means Committee looked at that bill and ascertained which provisions could fall within the parameters of the Byrd Rule and reconciliation, and ascertained that these provisions were the most likely to make it through. And the provisions that made it in were the funding to improve the accuracy and reliability of certain skilled nursing facility data, ensuring accurate information on cost reports, survey improvements, and the nursing staff requirements. So these 4 provisions were included in the markup, or they were proposed to be included in the markup. We did an action alert and asked all of you to reach out to your representatives and tell them to include these provisions, and they were included in the Ways and Means markup, which is great news. And the good news is that the House introduced a bill on the 28th, and these provisions made it into the House reconciliation bill. So that is good news. It made it into that bill. The bill hasn't been voted on yet. We're not sure when it will be, and bills can change, obviously. But nevertheless, those provisions have made it in. What also is going on right now behind the scenes is negotiations occurring now within the House itself and within the Senate itself, but also between both the House and the Senate. And one thing to remember is that these bills are huge. These reconciliation bills are trillions of dollars. So there's a lot of different people trying to influence what money is getting into these bills. So there's lots of machinations all over the place. But nevertheless, the negotiations continue. So one caveat here is that it's not clear that these provisions will make it into the Senate reconciliation bill. And we are concerned about that. We are currently reaching out to senators, and Lori will talk about what you can do as well to reach out to your senators to let them know that we want these provisions included in the Senate bill. Next slide, please. So there are other provisions as well that we are supporting that are included in the House reconciliation bill, and that is a significant funding, an increase in funding for the home and community-based services programs. These are Medicaid-funded programs that allow folks who would otherwise be in a nursing home to remain in their house, in their home, and receive services funded through Medicaid that allow them to remain independently in their homes. So there's significant investment there over a period of years, $190 billion to be invested in, at least in the House bill. How they are providing this money is through through improvement plans. It's provided the CMS, the federal government, providing grants to states to create HCBS improvement plans, which will focus on increased eligibility, increased services, focusing on workforce development and training and wages, and also the delivery of those services. And states will be invited to submit plans that address these areas. And for states that improve those plans and adopt and implement them, there's significant support from the federal government, including a 7% permanent increase in the federal funding, the federal match for these services, which is significant. 80% for administrative costs, and also they are giving 2% for 2 years for states that promote self-direction. All of this is capped at 95%. So the most the federal government will pay is 95%, and then the state will pay the 5%. So this is a significant incentive to states to really update their programs, increase eligibility, and There are other things also in the bill as well, funding for technical assistance to states in developing these plans and also implementing, and it also creates a quality measure and improvement program for home and community-based services, metrics on delivery of services, et cetera. Next slide. And there are also important provisions that are Elder Justice Act provisions. These are provisions under the Elder Justice Act that are designed specifically to address protections for elder Americans. It was included in the Ways and Means markup, and it made it in both of these, the HCBS and this Elder Justice Act provisions made it into the House bill. There's some significant spending here for on these provisions. Increased funding, almost 173 million over 3 years for long-term care ombudsman programs, which we certainly support. 1.6 billion over 4 years for long-term care workforce development. And this is significant. This includes wage subsidies, tuition reimbursement, affordable childcare and transportation and training. So investing in the long-term care workforce. $1.4 billion for adult protective services agencies, and grants and training for community-based organizations, AAAs, area agencies on aging, to address social isolation and the elderly population. $250 million for that, and then $500 million for medical legal partnerships, which are these relatively new phenomenon where legal attorneys are placed within medical providers and help assist patients, often low-income patients with other legal issues that might be affecting their health or their life. So we're going to talk more about what we're doing now and what we need you to do to ensure that these provisions get passed and get included in the Senate reconciliation version. As Robin said, we're going to have 2 bites at the apple here. We have the initial bill Robin spoke about, and then we have 4 provisions of that pulled out and put in the reconciliation. So we are very hopeful that these provisions will make it through on reconciliation, and we will have this really momentous change in nursing home care. So I am going to pass it on now to Jocelyn.
Hi. So we wanted to take a few minutes to talk about other legislation that's out there. This isn't comprehensive and certainly doesn't represent all of the legislation that exists, but we're highlighting 3 bills right now that we want to ensure are on everyone's radar. Right now, our focus is on reconciliation. Sam explained why this is so important. This is what's going on in the moment, and it's what we need to focus all of our attention on. But once reconciliation is over, we're going to turn our focus to several other things. The other provisions in the nursing home bill that Robin spoke about earlier, and also additional legislation. This, and Sam just said this, but this is not one and done with reconciliation. It's the start. And so here's a quick overview of what else is out there. Next slide, please. The Essential Caregivers Bill. The Essential Caregivers Bill is bipartisan legislation that gives nursing home residents the right to access essential caregivers during any public health emergency. We saw throughout the pandemic, and continue to see, the impact that the visitation ban has had on residents. For months, residents had no in-person access to visitors, and even now, 19 months later, there are many facilities that continue to ban visitation or severely restrict it. We've seen the serious emotional and physical decline that this has caused. The impact on residents has been devastating. This legislation would allow every resident to designate 2 essential caregivers who could enter the facility even when visitation is shut down in a public health emergency, to provide support, assistance, and companionship to the resident for 12 hours a day. These visits will be guaranteed as long as the essential caregiver follows all of the same safety and infection protocols required of staff. This ensures they don't pose any increased risk to residents. If the essential caregiver fails to follow these protocols, they'll be denied entry. This legislation is critical, as many of you know, to residents. It ensures residents receive critical support and assistance. Essential caregivers can help with daily tasks such as eating, drinking, movement, toileting, dressing, grooming. When facilities are short-staffed, as they've been throughout the pandemic, this is essential. The emotional support and companionship that essential caregivers provide is also critical. We know many residents died last year as a result of isolation and neglect. This bill also allows essential caregivers to monitor residents' care. Essential caregivers help just by being physically present in facilities. They can monitor what's happening within the facility, and they can report concerns so that they can be addressed. We know that so many residents' needs went unmet over the past 19 months, and some residents didn't receive even the most basic level of care. We've also seen facilities take enormous discretion throughout the pandemic, limiting visitation to 15 minutes twice a week, only allowing visits during working hours, even limiting the compassionate care visits that CMS requires for residents who experience significant declines. This legislation would ensure that does not happen again. It's a balanced way to ensure that residents stay safe in an emergency, but don't suffer the devastating consequences they did from the visitation ban during COVID. Next slide. So this bill, the Quality Care for Nursing Home Residents and Workers During COVID and Beyond Act, has many provisions that would dramatically improve the safety and rights of nursing home residents. It addresses many of the problems that we saw highlighted during COVID-19 that are actually long-standing issues, and I think we all understand that. In terms of staffing, you heard Robin talk earlier about minimum staffing standards. This legislation requires minimum nurse staffing levels and ensures a total minimum of 4.1 hours of care per resident per day, with 0.75 hours of care provided by a registered professional nurse. This is a big deal. And even with the staffing provisions that are in the reconciliation bill, we do, as Robin said earlier, intend to continue pursuing this. This bill also expands training requirements and supervision for all nursing staff. It prohibits pre-dispute arbitration agreements, which is an issue we're going to come back to in a few minutes. It requires informed consent from residents before prescribing psychotropic drugs. So it sets up a protocol to ensure that facilities inform residents of possible side effects and risks of these drugs, including black box warnings, and requires facilities to explain the other ways they try to address the issues that they saw before suggesting these drugs. And so importantly, it requires written informed consent from residents before treatment. This is so important because, as we know, there's been a rise in the use of antipsychotic drugs in nursing homes. And we saw this particularly as the pandemic started. These drugs are only appropriate for patients with specific mental disorders, and they can be very dangerous when prescribed off-label. The bill also has many other important provisions, and many regarding COVID. It requires facilities to employ a full-time infection preventionist. It strengthens infection control. It requires facilities to provide comprehensive worker training around COVID, to provide sufficient PPE, and at least 2 weeks of paid sick leave for all employees. It includes many other COVID provisions, and it would make a huge change in the lives of nursing home residents. This is such important legislation, and it is something we will remain focused on after reconciliation. Next slide. Finally, the Fairness in Nursing Home Arbitration Act. This bill both prohibits and nullifies any existing pre-dispute arbitration agreements in nursing homes and in home and community-based services and home health services. So you've heard us reference arbitration in other bills today. It's important to understand that currently, nursing homes can hide arbitration agreements in admission contracts. They're required to mention them to you so you can decide whether or not you want to agree. But when someone's being admitted to a nursing home, arbitration is almost always the last thing on their minds. Nursing homes can have you sign these agreements at other times too, not only at admission. So just to quickly explain for anyone who isn't familiar with what arbitration is, it's an agreement, usually a section of a contract, that takes away your right to bring a lawsuit against whomever you're signing the contract with. It disadvantages consumers, and in this case, residents, because it takes away their right to go to court to handle a dispute. And pre-dispute arbitration agreements mean that you're signing away that right before something goes wrong. You're signing away the right to hold the nursing home accountable even when it does go wrong. So you're not making this decision on equal footing after the harm has occurred. You're deciding before you have any idea of what might happen that you won't have the remedy to take your facility to court. This is incredibly unfair to residents and families. Many residents and families at admission likely skim through their contract, and even when a staff member points out the arbitration clause, which they're required to do, they're likely not going to have any pushback against it. And once it's signed, it covers all types of harms: injuries from neglect, receiving the wrong medication, having your money or belongings stolen, being physically or sexually abused, and even death. Arbitration is fundamentally different than bringing a lawsuit in court. A private arbitrator, not a judge, decides the outcome. There's no jury. It does not have to follow the rules of evidence. Decisions are always final, and often they're confidential. So the harm that occurred is hidden and no one knows about it. It can also be very costly to consumers, and nursing home residents often don't have a lot of money. Arbitration is also a business. There are arbitration companies, and arbitrators have a financial incentive to find for the nursing home so the nursing home can give them more business in the future. That's why this legislation is so important. It prohibits these agreements regardless of whether they're in your admission contract or if the facility later asks you to sign something, and it nullifies existing agreements. You probably noticed that Robin mentioned an arbitration provision in the nursing home bill, and I referenced it a few minutes ago in the Quality Care for Nursing Home Residents and Workers During COVID and Beyond Act. This is an important issue. The Fairness in Nursing Home Arbitration Act is very important, and arbitration is an issue that Consumer Voice will continue to work on. So the three bills that I just mentioned are an example of what we're going to be focusing on once the process is over. Right now, again, we are laser focused on reconciliation. And with that, I'll turn things over to Lori to talk about what you can do to help with these efforts.
Thanks, Jocelyn. Thanks to you and to Robin and Sam for going over the different provisions of the bills and explaining them. As you can see, a lot has been happening in Congress. Many of you I know have been working on a number of these bills, some of them for quite a long time. Legislation oftentimes doesn't happen very quickly or doesn't happen in a vacuum. Sometimes it takes years to develop and refine different pieces of legislation and get it passed. But when you have opportunities, you have to strike pretty quickly. And as we are looking forward to what's happening between now and the end of the year, again, we wanted to share opportunities with you about how you can make a difference, and also really to raise some of these issues and these different pieces of legislation with you. So as you even continue to look forward with advocacy that you're doing on behalf of your loved ones, on behalf of the people that you're working for, and on behalf of that, you can keep these in mind and keep working towards legislative advocacy. It's really critically important that educating your Congress people is something that you continue to do on a regular basis. They should really be hearing from you a lot to hear about the different issues that you're facing in long-term care facilities, what your loved ones are facing, ideas for solutions that can be incorporated into different pieces of legislation in order to fix some of the long-standing problems that we've been working on. So that is something that the more that we can educate members of Congress about the consumer perspective of what's happening in these facilities, the better. So as you've heard some of the staff mention, we're really focused over the next couple of weeks, particularly on reconciliation. And that's because that's what's happening right before us right now. It's the bill that Congress is laser focused on in terms of needing to get passed. They need to pass a budget bill. And as Sam had mentioned, because this needs to pass with the majority vote instead of being subject to the filibuster rules, it's one where we look to see what appropriate pieces of or provisions can be included into this bill in order to get passed, because we're looking at needing 50 votes instead of 60 votes in order to pass it. So while we really would have liked to have seen more provisions from the different bills that we've talked about today included in the Ways and Means markup that occurred 2 weeks ago, the committee that was developing the legislation and developing the markup decided that these 4 provisions were the ones that they felt most likely they could include in the bill and have success in having it move forward. And while certainly we have been continuing to work with members of both the House and the Senate on getting additional provisions included, at the very least, these 4 provisions are what has been included in the current bill. So as we look at the current House House bill that has gone to the floor of the House for consideration and will be voted on, we need to ensure that these provisions remain in the House bill. As we turn our attention to the Senate, they're still working on their bill and developing it, and will be going to markup soon. And we want, at a minimum, these 4 provisions to be included in the Senate bill, because as was mentioned earlier by Sam, when each body passes its version of the reconciliation bill, they have to come back together and make their bills match. And that means there's going to be negotiation with what stays in and what gets kicked out of the bills. And so the more commonality there is between the 2 bills, the more likely I think the chances are that the provisions will move forward. And so at a minimum, we are asking you to tell your member of Congress to include the nursing home provisions from the House bill, keep them in the House bill, and on the Senate side, include them in the Senate bill. And those 4 provisions, again, are funding to improve the accuracy and reliability of nursing facility data, ensuring accurate information on cost reports, survey and enforcement improvements, and the nurse staffing requirements. This is all being worked on over the next couple of weeks. As you know, today is actually a deadline for budget bill and debt ceiling limits. So we know Congress is going to be working pretty quickly, but we do know that there's still going to be work happening over the next couple of weeks on these bills. So we definitely think you need to be telling your members of Congress to, at a minimum, include these provisions into their legislation. As we look forward, that doesn't mean we stop advocating for the other bills that we've been working on. We still really want all of the provisions of the Nursing Home Improvement and Accountability Act to be passed. The Essential Caregiver Act, we want to see passed. The Quality Care for Residents and Worker Act and the Fairness and Arbitration Act, along with other bills that we've been working on. So we need to also think about continuing and ramping up our advocacy on these provisions as well. And that also will continue to occur and ramp up as we move past reconciliation, move towards the end of the year, and until we can actually get them passed. And so we wanted to put these bills before you so that you have them in your mind. We know that many of you are working with your members of Congress on them, and we want you to continue to do that, but also ensure that you're asking them about reconciliation or talking to them about reconciliation at this point as well. It's really, really critical to make your voices heard. As we think about the advocacy that needs to be done around legislation, consumer stories, consumer experiences, resident and family experiences are really critical for your Congress member to get information about, as I mentioned before. And we have been encouraging you to be contacting your members of Congress to let them know what you actually are experiencing in long-term care facilities. On the other side, you know that the nursing home industry is in with the members of Congress on a daily basis. We know that to be true. We know that many of the provisions that we've been talking about today, particularly those related to staffing, the staffing study that's been proposed, minimum staffing requirements that we've been working on for, it feels like, decades, improvement provisions and accountability provisions around enforcement and transparency of information. They often oppose those provisions, and they are in there talking to their legislators as well, letting them know their perspective on these different bills, which is why it's really very critically important that they hear not only from us at the Consumer Voice and the advocacy partners in the organizations that we work with, but they hear directly from you, their constituents, about why it's important that they include these protections in legislation. So we really do encourage you to be contacting them. If you're not familiar with contacting your member of Congress, there are 2 easy ways to do so. One is to call the Capitol switchboard, and the number is on the slide here, 202-224-3121, and tell them where you're from and that you want to be connected with your congressman or your senator, and they will put you through to their office and let you know who they are, so that you can call directly and speak to a representative from your congressperson's office. You can also go to the website at www.congress.gov/members. And by putting in your address, or even just searching, if you know who your congressperson is, you can get more information about how to contact them directly, or go to their webpage and get more information about how to get in touch with a member in their office. But it's really easy to find your member of Congress, and you should not hesitate to do so. When reaching out to them, prepare yourself a little bit in advance. Prepare the message that you want to ask. Have a few points that you want to address with them. Know what it is that you want to tell them and what your ask of them is going to be. So prepare that in advance and have it ready so that when you do call or email them, you're ready to put it into effect. Identify yourself as a constituent. That's really important. They definitely want to be hearing from you as a constituent and what issues are really important to you. So they will probably ask you. They may ask you if you're a constituent, and so let them know that you are, because they take your calls very seriously. When you get in touch with a staff person or share your message, be very clear and concise about what it is that you're asking them to do. If you have a personal story or example, include that with you. If you've had an experience in a long-term care facility, or can share an experience of why it's important to increase staff, for example, or have minimum staffing standards, or have more focused enforcement when a facility is not in compliance or a resident is harmed, share those examples with your member of Congress, because it puts a personal face on what the issues are and helps connect, make a connection, I think, a little bit better in order to have them understand why the legislation is really important. And it's at that point then you would say what your ask is, whether it's to be in support of a particular bill or provision, or, as we've been saying today, ask them to include the nursing home provisions from the House bill into the Senate bill. And we'll share these slides with you so you have a list of what those provisions are again. And don't forget that whether or not your congressperson is of your political affiliation or not, always be courteous and thank them for the work that they're doing, and thank the staff for the work that they're doing. We'll turn to questions in a minute, but I wanted to also take this opportunity to remind you that the Consumer Voice Conference is coming up at the beginning of November, November 3rd through 5th. We hope that you'll be able to join us there. We'll be talking more about a lot of the issues and the bills that we talked about today. We've invited some congressional staff to join us, and hope to have messages from some of the Congress people who've been working on these issues. So please do join us, where you can learn a lot more about advocacy that can be done, and also about the different issues that we are working on. Also, don't forget that October is Residents' Rights Month. That starts tomorrow. Reclaiming My Rights, My Home, My Life is the theme for this year. We've got a lot of information on our website about Residents' Rights Month, including entries into our Resident Voice challenge, where we ask residents to send us in artwork or essays or poems or information about what the theme is this year. And we have a lot of great stories and artwork from residents that we hope that you will take a look at. So with that, we're going to turn to the questions and answers, and try to answer as many of those as we can in the couple minutes that we have left. So I'm going to turn to the team and see if someone can queue up a question for us.
Sure, this is Jocelyn. There was a question that someone asked, I believe it was in reference to the nursing home bill Robin was talking about whether or not there is any if there are any financial transparency provisions in the bill. And Robin, I don't know if you wanted to speak about that for a minute.
I'd be happy to. Sadly, there aren't any. There is, as I pointed out, a requirement for cost reports to be audited. So that is an important first step towards getting to financial transparency. So in that respect, there is something in there. But there isn't anything as it specifically relates to, for example, related third parties. We had advocated for that kind of requirement to be included. It wasn't, but we are talking with other members of Congress about this concept. We're referring to it as a consolidated cost report because it requires facility to submit information about its parent companies, all related party entities, holding companies, everything, and would achieve the kind of financial transparency, I think, that is being asked about here. So not in reconciliation, not in the Nursing Home Improvement and Accountability Act, but we are still pursuing it, and hopefully perhaps we could see it in a separate piece of legislation.
Thanks, Robin and Jocelyn. Can someone else queue up another question?
I think this was one that makes sense, and one that's been asked a couple of times is, why do we need a staffing study? We know facilities are short-staffed. We've known that for years, but why do we need a study?
So I will jump in. In many respects, we don't think you actually need a study to establish the problem. But one of the issues that has been raised is that the last study that was done in 2001. And there have been concerns voiced that that data, that information is too old. And so the intent here is to have the staffing situation be evaluated as it is now, with the increased needs of residents, and to make recommendations about what the minimum staffing ratios should be, and then to promulgate regulations related to that. So I think in part, the drafters of the legislation wanted to respond to this concern about out of date information and data.
Yeah, I think, and this is Sam too, to piggyback on that. I mean, we all know the how powerful the industry is and the amount of money that they give to Congress, and I think we think that there is a standard. However, I believe the people who crafted this thought that, well, the industry would easily push back and say, you know, it's been 20 years, and they want this to work, and they want a minimum staffing standard to occur. So they want to dot their I's and cross their T's, and that does mean we have to wait, but hopefully it will lead to some very significant changes for residents.
This is Robin. I would just chime in to build on what Sam said. Is in fact, the industry is already pushing back even to the requirement for a staffing study. So that just shows you how hard we all need to work.
Right. Another question?
Sure. There were a few questions that related to whether or not there are other things we could try to get into reconciliation. And so, you know, I thought I would raise that point and also, you know, just say we would love to get everything into the reconciliation bill. But, you know, as Robin just mentioned, there's already a lot of pushback with what's in there. So we are trying to stay very focused on ensuring we keep what we have. And I just wanted to open it up to see if anyone else had anything to contribute to that.
Mm-hmm.
Yeah, I think so. There was a question about the Essential Caregivers bill, and it was a nice little discussion going on in the Q&A that, I mean, the bill on its face doesn't, you know, it doesn't appropriate any funds. So it doesn't necessarily affect it. To be part of reconciliation has to increase revenues or increase spending. Then Miko made a really nice point that, you know, well, we're losing money or staffing, or what about the generation of CMPs, the violation? But it needs to be more tangible. There needs to be a more tangible connection to the increase or the decrease, and it has to be more than minimal. And I think a lot of that would be speculative at this point. Not that we don't want it in there. I mean, trust me, we have been pushing the Essential Caregivers bill as much as we can with every senator and representative we speak with. But we think as part of the reconciliation process, it's just not a fit. And we've also heard that from some folks on the Hill.
Mm-hmm. I think that I think that there may continue to be opportunity to get some additional provisions in. We're continuing to ask, especially since the Senate is still working on drafting its legislation and which pieces that they're going to mark up. So we are continuing to ask for them to include additional provisions in. We had been asking the House to include more. Certainly it's something that you can continue to ask for. We know as the House was making its decisions, it ended up with those 4 pieces in about nursing homes from the Nursing Home Accountability and Improvement Act. But obviously we would like as many provisions as possible put into the reconciliation. So we all need to continue to advocate, and whatever doesn't get in, we'll just need to continue working on as separate pieces of legislation later on. I know there have been several questions coming in about relation of these bills to assisted living and other settings. Several of the bills are nursing home focused, like the Nursing Home Improvement and Accountability Act, the Arbitration in Nursing Homes Act, the one of the other bills that the Essential Caregiver Act that Jocelyn had talked about, a couple of those pieces. So several of them are nursing home focused. There are a number of provisions already included in reconciliation, like some that Sam talked about, related to expansion of Medicaid dollars into HCBS. Those apply to non-nursing home settings, as well as there are provisions in there for support for staff that are involved in home and community-based services as well. So those provisions potentially could apply to assisted living, but some of the provisions we've talked about today are nursing home specific.
If I could just add one quick thing to what Lori said. There has been a specific question about the ban on arbitration. It would not apply to all assisted living facilities, but it would apply to those that take Medicaid, because there is that provision about applying to HCBS providers.
Thanks, Robin. One of the reasons why we wanted to specifically do this webinar today, again, is to share with you the different pieces of legislation that are moving through Congress or being considered, but also, again, to reinforce the importance of having your member of Congress hear from you. Not too long ago, in a conversation I was having with a member of a congressional office, we were talking about the need for including staffing provisions, for example, or provisions that were important to residents and families of long-term care. And they came back and said to me, if we included something like that, the nursing home or the industry would be all over us. We'd be hearing nonstop. Our phones would be going off the hook about why they needed to include those provisions in there. And it's really disappointing that they're only hearing from one side and making decisions based on that. So it's really critical that they hear from residents, from families, from advocates about why these provisions are important. And the louder our voices can be, the more likely that we will have our opportunity to get the legislation passed. So with that, we've kept you for the hour. We appreciate your engagement and attention today. Thanks so much to Robin, Jocelyn, and Sam for their work on all of these issues. And thanks to all of you for working so closely with us on these as well. We are going to close the webinar for today. Contact us if you have questions or if you need more information about any of the provisions, and we will be sending out by email more information as well as posting it to our websites, and that will include the recording from today, the PowerPoint from today, and we're working on additional information that we can be sharing with you to help you in your advocacy. So with that, we're going to close. Thank you so much and have a good rest of the afternoon. Take care.